Liver cirrhosis. This is a chronic disease which is life-threatening and is a prolonged process, inflammatory process, in which the normal tissues of the parenchyma of the liver is destroyed and is replaced by the fibrous tissues, due to which the liver size is shrunken, shriveled up, and is converted into hard ball-like structure and functionless one. The stages of the liver cirrhosis is divided into two main categories. Compensated cirrhosis. This is the initial stage in which proper and early diagnosis and the management treatment can be maintained, and the disease can be reversible, can be treated and can be corrected and reversed. Second stage is the last stage or the final stage, in which the recovery or the disease become irreversible. This is called as decompensated liver cirrhosis. The symptoms produced in the liver fibrosis is loss of appetite, weakness, fatigue symptoms, malaise, loss of weight, jaundice, pruritus, ascites, depression, fits, tremors, respiratory distress, palpitation, variation in the blood pressure. There is erythema, palmar erythema, spider angioma, caput medusae. So these are the, when there is osteoporosis, myalgia, arthralgia, these are the various symptoms produced in this disease. The complication of liver fibrosis is, as the liver is the main gland of the body, which is meant for production of the protein and detoxifying the toxins and the other chemicals which are ingested, and they are conveyed from the GI tract via the portal vein into the liver. When the detoxification process is diminished, obstructed, and reduced, the excess of ammonia, which is not excreted, that damage and affect the function of the central nervous system. This is called as hepatic encephalopathy, due to which there is depression, tremors, and there is reduction in the cognitive abilities of the brain, fits, and finally state of coma occurs. When the detoxification or the excretion of excess of estrogen is lowered one, or is diminished, there is elevation of the estrogen level in the blood, and that produces the symptoms of gynecomastia, erectile dysfunction, atrophy of the testicles, and the retard the process of spermatogenesis. Sperm production process is affected by the action of the estrogen in the male, whereas in females there is disturbance of the menstrual cycles, there is disturbance or the reduction in the ovulation, that is the ovulation process is also affected and is diminished, due to which there is the infertility chances in the females. Next is the complications. That is there is hepatorenal syndrome and then hepatopulmonary syndrome, due to which there is anuria, dysuria, oligouria. That is the function of the kidney is gradually decreasing one, leading to the kidney failure and needs dialysis for the excretion of the waste product which are accumulated in the blood. Similarly, due to portal hypertension, that is the pressure of the fibrotic material over the portal vein within the liver, that produces constriction, that is the lumen of the portal vein is reduced. There is backing of the blood in the liver and spleen and the GI tract. There is pooling of the blood in these organs, due to which there is ascites, pleural effusion, splenomegaly, hepatomegaly, and there are other complications, that is esophageal varices bleeding, piles bleeding, which leads in melena. So these are due to the portal hypertension created by the pressure and the occluding process of the fibrous tissue, which has produced by this disease, and the normal tissues undergo necrosis and the connective tissues sought, they are replaced by the functionless hard fibrous material. So this is the basis of the liver fibrosis. When there is ascites, there is enlargement of the belly, pleural effusion. These all produces the complication. When the ascitic fluid is infected, that produces the bacterial peritonitis, and there is fever, rigors, and the other complication of the within the abdomen cavity.